I'm a fellowship-trained breast surgical oncologist. I'm Dr. Amani Jambakar, and welcome to my October myth-busting series, where I bust a different myth about breast cancer every single day of the month. Today's myth is one I talk about all the time, which is that needle biopsies will cause breast cancer to spread. This is an ultrasound image of a needle biopsy. The arrow's pointing to the needle, which is white, and it's coming in to sample this hypoechoic or dark irregular mass that we see. And this is a mass that most radiologists would agree does need to be biopsied. Without doing the biopsy, there's no way of knowing though that it is for sure cancer, because this is not a slam dunk that it's cancer at all. There's a lot of other things it could be, such as a fibroadenoma or a benign tumor of the breast. Sometimes we can reliably differentiate between the different types of tumors people can get in their breast on ultrasound and on mammogram and MRI, but we don't really know for sure until we sample it what we're working with. And if we don't know what we're working with, then we really don't know what the appropriate treatment is. For example, if this patient had decided that they did not want a needle biopsy and just went to a surgeon and said, go ahead and just take this out because I'm worried the biopsy is going to cause the cancer to spread, then the surgeon would have just taken out this mass or this lump right here. And if the pathology report had come back and this ended up being an encapsulated papillary carcinoma or a type of breast cancer which can look pretty round on an ultrasound, then the surgeon would have had to go back in and take out more in order to have what we call oncologic margins, or taking out enough tissue around the tumor to ensure that it's not going to come back. And then this patient would have had to have a second surgery. Instead, if they agreed to do a needle biopsy, that is a much less invasive procedure than doing a whole surgery, and they might have found out that it was something that didn't even need surgery. And if it was cancer, there have been no studies that have shown that putting a needle into a cancer will cause the cancer to spread. So if you're diagnosed with calcifications or a mass or lump in the breast and the radiologists are recommending a biopsy, I highly recommend that you follow their advice.